You've likely heard it. Postpartum is 6 weeks. You are supposed to rest, wait around for 6 weeks, not really do anything, and then poof, magically at 6 weeks, you have your appointment, you get cleared, you're given the green light, and you are expected to be able to return to everything that you were doing before without issues. Back to your pre-pregnancy workouts, back to sex without any irritation or complications, back to feeling like yourself again. But not only is this inaccurate, but this information is really failing new moms. So I want to go over something with you that I really keep in mind as a doctor of physical therapy and a pelvic floor specialist, that is the postpartum recovery timeline that I work with when I'm working with all of my clients, and that I really wish every new mom knew before she went into the hospital to give birth, because our expectations matter. Postpartum is not just 6 weeks. Even when you are looking at what postpartum is in the literature, it acknowledges, the scientific community at large acknowledges that it is longer than 6 weeks. It is broken down into phases. There's the acute phase, which is immediately after giving birth, the first 6 to 12 hours. There's the subacute phase, which is up to 6 weeks. And that's the phase of postpartum that we are really kind of all referring to when we talk about postpartum being 6 weeks. But then there's delayed postpartum, which can last up to 6 months. And even that is kind of falling short. So the guidelines of just sit around and wait, do nothing but rest for 6 weeks are, again, not accurate, and they're not matching up to ACOG, the American College of Gynecology, their current recommendations, which are current as of 2020. So this is several years ago. And yet we are still hearing the same thing of just wait for 6 weeks and then you're given the green light and expected to just jump back into everything you were doing. So in this video, I'm going to break down the phases of postpartum, what it means for your body, and what it means for what you can be doing and what you can be expecting. Because again, our expectations are everything. They're the difference between feeling like you're on track and making progress and moving in the right direction and really feeling good about your postpartum experience, and feeling like a failure, like something is wrong, like your body is failing you because you are wanting to do a little bit of something at 6 weeks, you're getting a little bit antsy. And then maybe when you are cleared and jumping right back into everything, things feel way off. And so you feel like you're doing something wrong. But no, you're not doing something wrong. Your body isn't failing you. We just need to reset expectations, have a better idea of what's going on with our bodies postpartum, and how to progress in a really beneficial way that's going to support our recovery and then support how we're feeling emotionally and about ourselves in the process. So first, before we go any further, we'll talk about ACOG's newer recommendations. Again, it's not to just wait for 6 weeks before exercising. They're actually encouraging a return to exercise sooner than that. And this is what they say. Healthy pregnancy and a normal vaginal delivery, you should be able to start exercising again soon after baby is born. Usually it is safe to begin exercising a few days after giving birth or when you feel ready. Aim to get about 150 minutes of exercise per week, which breaks down to be about 20 minutes a day. Now, they're talking about a gradual return to 20 minutes of exercise a day, not jumping into that all at once. But again, really great that we are actually encouraging some physical activity, which we know is going to promote our physical recovery, but also our mental and emotional well-being in postpartum. But it is still a little bit fuzzy. So we're going to break it down. What does that mean exactly? When will you know you're ready? So we'll talk about the immediate postpartum phase. So phase 1, immediate postpartum, we're talking 0 to 6 weeks. What is happening to your body during this time? The big things that are happening here, one, there's that plummet of your hormones right after delivery. So our sex hormones kind of tank, and then our oxytocin increases. There's that whole shift. That is normal. We are expecting that to happen. From a physical standpoint, our uterus is returning back to its pre-pregnancy size. So it gets really enlarged to house baby and placenta. We give birth, and then it gradually, within that 6-week time frame, starts to return back to its pre-pregnancy position. Also, during that time, our other organs that were kind of shoved out of the way begin to settle back into position. Also, during this time, our tissue is healing and recovering. So the wound left in our uterus from our placenta is closing up. And this is happening for two reasons. One, just the natural clotting and tissue healing process, but then also it is getting smaller as the uterus itself is shrinking. It's happening at the same time, right? We have a big uterus, big wound, starting to get smaller. The wound also is getting smaller as, again, we're having clotting happening and tissue healing, rebuilding, and remodeling occurring. If you had any other damage to your tissue, whether it's an incision from a C-section, if you had vaginal tearing or an episiotomy during the 6-week time period, that is also healing. So you're going from an incision to that incision being approximated, so coming together, healed up, and a scar is starting to form. Does not mean that it is back to what it was like pre-injury or pre-incident. That's going to take a lot longer for that to happen, for scar tissue to remodel, but it is closed, and so the risk of infection from that area is down. So those are really the big things happening during the 6-week time frame. And from a physical recovery standpoint, what we want to prioritize is improving circulation and pain management. And that pain management is going to come in part kind of hand in hand with that improved circulation. Also, as we're improving circulation, so when we said pain management is being helped with that, and then also it's promoting tissue healing with that good circulation. So what can we do for that? That is where that gentle walking, easy paced walking comes in, and starting that really from day 1 to day 2, a few minutes talking within the room initially. This is especially important if you had a C-section, but we can dive into that on another video at a later date. But very important with a surgical procedure, but also important vaginal delivery as well. We want to encourage a little bit of walking, gradually increasing throughout the first week and then kind of going on from there, and balancing that out with rest. And ideally with supine, lying flat rest. That way we are taking the pressure off of the pelvic floor during that time frame. So that's happening really from within those first few days. The other things that we want to focus on during the 6-week time frame, and I'm going to break it down into 0 to 2 weeks and then continuing out to 6, is reconnecting with our pelvic floor, reconnecting with our body, breath work, and mobility. So in weeks 0 to 2, again, that's that little bit of gentle, easy-paced walking, breath work, really getting a full 360 diaphragmatic breath that's going to engage and kind of start to reconnect with the pelvic floor. That's going to be really great for nervous system support, which is very much needed after having a baby. So really working on breath work, and then also mobility, and that includes our shoulders, our upper back, because that all gets really stiff and tight during pregnancy, and then again in postpartum as we are kind of curled up around it over our baby. When we're thinking about the pelvic floor mobility-wise, we're thinking pelvic clocks, pelvic tilts, and then kind of going from there. So as we're moving closer to that 6-week mark, we can start to move just from mobility work into really gradual, gentle strengthening. And we're not talking body weight here yet within this immediate postpartum time frame, but we're talking more like in bed exercises where you're going kind of with gravity and not against gravity. So that's the immediate postpartum 0 to 6 weeks. So that is really important to set the groundwork and the foundation for what's to come. So it's not 0 to 360, or 0 to 60 from birth to then all of a sudden 60 miles per hour at the 6-week mark once you are cleared. There's this gradual rebuilding. So now we're moving into that early recovery. And this is going to take us from 6 to 12 weeks postpartum. So what's happening with our body during this time frame? We are Our pelvis, our ligament laxity is starting to come back into that pre-pregnancy level. This can take longer if you are breastfeeding, and that is absolutely fine. But during this first 12 weeks, our pelvis is going from that open birthing position back more towards our pre-pregnancy positioning. This is important because it's going to kind of help with the length tension of what's happening with our pelvic floor and our hip and back muscles, where everything is attaching. So that is kind of the big thing that's happening during this time frame from a body perspective. And then what does that mean for your workouts? Where are we now in this earlier recovery? We are going from that mobility work to really kind of setting the foundation for our strength. So 6 to 12 weeks, we want to start with gradual body weight exercises. And then as we're getting closer to that 12-week mark, and as things are feeling good, starting to increase resistance, working with the resistance bands, maybe working with a little bit of lighter weight, kind of very gradually, depending on how you're feeling and how everything is going, increasing the resistance and starting to rebuild your strength. Again, kind of the biggest mistake that I see during this time frame is people, not really doing anything during the first 6 weeks and then jumping right back into what they were doing prior to pregnancy. So now moving into phase 3. This is where we're really continuing to focus on building strength and also kind of working towards that little bit of power as well. So what's happening with our body during this time is as our hormones are really starting to come back into like their homeostasis, working back towards what they were pre-pregnancy. Again, if you're breastfeeding, this can take a little bit longer, but starting to kind of work in that direction. Also, our muscles are starting to be able to handle a little bit more load because ideally we have been working the foundation already. So we already talked about gradually increasing the resistance on what you're doing. Hopefully during this time as well, you are starting to get a little bit more sleep, or at least figuring out some type of rest schedule that you can have, and really maybe prioritizing the hours between 10 p.m. and 2 a.m. as kind of those golden window for getting the best quality sleep that you can, because we know sleep during those early infancy time period is very different, and it can be a lot. So that is something that we also have to consider when we're ramping up and talking about the phases of postpartum recovery. Now, after this, we're getting into the longer term recovery, and this is really 6 months on. So we've worked on our mobility, we've reconnected to our core and our pelvic floor. We have gradually increased the strength. Our pelvis, our body is starting to shift back into its pre-pregnancy configuration. And then we have to keep in mind that while all that is happening, that even during this time frame, this longer recovery time period, that our pelvic floor muscles are still not 100%. It really can take 9 months to rebuild the strength in the pelvic floor, as everything is shifting and changing, as our hormones are adjusting, as our pelvic bones are adjusting again, and our levator ani muscles of the pelvic floor, the ones that stretch 2.5 to 3 times the amount or the length in order to deliver the baby, are only now finally coming back to their normal length tension relationship. So now that they're back to their normal length tension relationship, that's where you're starting to see that return to pre-pregnancy strength coming in. So during this longer term recovery, again, we are working on strength, starting to prioritize power, and going from that earlier time frame, that strength and power time frame, that 6 to 12 week mark, where I forgot to mention, but I'm going to jump it in now, towards the end of that time frame, like working up towards the 12 weeks, is where you want to start to think about adding in the power moves, adding in the higher intensity, the jumping, the plyometric type activities. And so now that we're moving into this longer term recovery phase, this is where we can optimize them. And this is where we can really get you back to doing all the things you were doing, making sure that you're able to jump on the trampoline without leaking, that you're able to return to running or start running if that sounds good to you, and just really starting to feel like yourself again. And just to reiterate that this is at that 6 to 12 month time frame. So in conclusion, postpartum is a lot longer than 6 weeks. It does not mean it needs to last forever. There are phases that our body needs to go through in order to heal and recover properly and to get you feeling really good again. So if you have any questions with that, feel free to leave a comment below. Otherwise, if you are wondering what to do and have more specific questions, I do have a really wonderful whole person, whole body 6-week early recovery program that I would love to get you in on. So I'll leave the link for that. And yeah, let me know if you like these videos. I'll be happy to leave more.